Yet another new strain of the coronavirus in the UK, this one with origins in South Africa, and the Health Secretary announced immediate action to stop it spreading.
We've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks. First, we are quarantining cases and close contacts of cases found here in the UK. Second, we're placing immediate restrictions on travel from South Africa. And finally, and most importantly, anyone in the UK who has been in South Africa in the past fortnight, and anyone who is a close contact of someone who's been in South Africa in the last fortnight, must quarantine immediately.
The variant called 501v2 has caused a surge of infections in parts of South Africa. It has a higher transmission rate and may be more prevalent in the young. Significantly, the mutations could enable the virus to elude antibodies from a previous infection.
That has the potential to mean that people can get reinfected, potentially. And that's something that we're actively studying at the moment to see how many of the recent infections and the cases that are coming through are possibly reinfections.
And what about the vaccine?
We're trying to very rapidly understand what the implications are for the vaccines.
Scientists are still getting to grips with the UK variant. There's still no evidence that it causes more serious disease, but it has spread nationwide with a higher proportion found in children. That could make control more difficult if schools are allowed to reopen in January.
Mostly during the lockdown period in November, you see a statistically significant increased proportion of cases in under 15-year-olds for the variant compared with the non-variants. Children are now more like adults in their infectiousness than they were with the previous strains. That will pose greater risks of in transmission involving children mixing with each other. And potentially there are challenges there for particular types of control measures and what we want to do with schools.
The chance emergence of 2 new variants that evolved thousands of miles apart underlines the importance of rolling out the vaccine worldwide. The pandemic isn't over until it's over everywhere.
One of the main reasons for the decision to push millions more into Tier 4 in England is the rate of new infections, with fears that this is being driven by the new variant of the virus. But this afternoon, the Health Secretary revealed that 2 cases of yet another variant have been detected in the UK. This one was first discovered in South Africa. Tonight, the government said it was temporarily stopping flights from there from 9 a.m. tomorrow. Our health correspondent Sophie Hutchinson reports.
South Africa, where another new variant of coronavirus is causing alarm. Scientists say initial evidence suggests it's more infectious than other versions of the virus, and doctors are reporting more young people who are seriously ill.
This new variant is highly concerning because it is yet more transmissible and it appears to have mutated further than the new variant that's been discovered in the UK.
The 2 people found in the UK with this variant are being quarantined along with close contacts. The government's brought in immediate travel restrictions with South Africa and says anyone who's been there in the past 2 weeks must self-isolate along with their close contacts.
The first people in France to get this vaccine this morning are a group of elderly people and their caretakers, about a dozen people or so, in this hospital behind me here. We are in Saint-Denis, a department in the north of Paris. It is one of France's poorest departments and also one of the departments most impacted by COVID-19. I spoke to a local official just a moment ago. He and a few other local officials had gathered outside of the hospital to show their support for those being vaccinated. He said he was excited that there's some good news happening to report in the department after so much hardship. They are being administered the Pfizer and BioNTech vaccine that's already being rolled out in the UK and the US. This is a slow and symbolic start to France's vaccination process. Another dozen or so elderly people are going to be getting the vaccine this afternoon in Dijon. France is then really going to ramp up the vaccines in nursing homes in January and then extend it to other vulnerable and at-risk populations in February before starting to vaccine the general public in the springtime, perhaps as early as April. The big challenge for the government is going to be convincing people to get vaccinated. They've They've made it clear that the vaccine is going to be free and voluntary for people in France, but there is quite a bit of vaccine skepticism in France. A poll done earlier this month by France's public health agency found that less than half of French people, only 40%, plan on being vaccinated.
Meet Edith. The centenarian resident in a retirement home in Halberstadt has become Germany's first recipient of the Pfizer-BioNTech COVID-19 vaccine. While a continental rollout of the serum was due to begin on Sunday, even that wasn't soon enough for care staff who declared that every day they waited was a day lost. Around 40 of Edith's fellow residents and a dozen or so care staff were also given the shot on Saturday, just hours after the vaccine arrived. It was the same story in Budapest, with Hungary choosing to give medical staff the jab as soon as it arrived. An initial delivery was enough for 5,000 people to be inoculated. Slovakia too moved ahead of the European Union's official timeline. The first vaccination there was broadcast live over social media on the official page of the country's Ministry for Health.
The refrigerated vans drove through the night. Destinations including Rome, Paris, Spain and Hungary. The precious cargo, the vaccine developed by Pfizer-BioNTech, kept it between -70 and -80 degrees. The mass inoculation is due to start in a coordinated launch later on Sunday. But the first jab went to a worker at a hospital in Budapest.
A vaccination plan is ready, with health workers at the front of the queue. Those working with patients in intensive care and emergency care units will be vaccinated first, so they can continue their heroic struggle to save lives.
Europe has seen 16 million coronavirus cases and suffered more than 400,000 deaths. The approval and distribution of this first vaccine is reason for considerable hope across the continent.
We have in total 19,500 doses, which makes 3,900 vials. These doses will be stored in our freezer at -80 degrees, which will be then distributed to the different elderly homes and public hospitals.
Wir starten die Impfkampagne mit großen Schritten.
We will start the immunisation campaign on a large scale. 1.3 million doses of vaccines will be delivered all over Germany before the end of 2020. And then from January, it will be even more each week, almost 700,000 doses every week in January, more than 10 million doses in the first quarter.
The relentless spread of the COVID-19 virus and the news that more infectious variants are evolving has lent even more urgency to the vaccination programme. The variant, first identified in the UK, has now been discovered in other European countries. To try to contain that variant, thousands of truck drivers have spent Christmas stranded at the UK port of Dover and prevented from crossing to France unless they test negative for the virus. The backlog remains stubbornly large, despite the efforts of military reinforcements. And lockdowns have ruined the festive period for traditional high street retailers, with shoppers ordered to stay at home. Coronavirus has hollowed out the UK high street. This is Oxford Street, London's primary retail avenue. And instead of hundreds of thousands of people out taking advantage of the Boxing Day sales, the shops are closed. Instead of festivity and bustle, it's forlorn and barren. The street, empty. With coronavirus, Europe has endured much the same torrid 2020 as the rest of the world.
So right now it's just 3,000 doses arriving this morning, creating big optimism, but a small amount with the beginning of a large amount. They say there'll be about 1.5 million doses by the end of January. And in total, the deal was buying 34 million doses of vaccine. That's in a country of 130 million, so it's only a part, but it's a very big start. The idea is, first of all, to vaccinate health workers. And Mexico's had perhaps the worst in the world for deaths of doctors and nurses in the hospitals with the virus. So that's very important. And then it's simply going down in age groups, starting with people who are 80 plus, going first to people with underlying conditions, and then going down 70 plus, 60 plus, 50 plus, kind of working through the population. It's beginning here in Mexico City, which is also one of the worst hit areas. Hospitals right now are at very high capacity. Some predictions are that they will in fact collapse. The whole hospital system will collapse in the coming month. So real kind of urgency here in the capital, particularly in the large working class neighborhoods, to try and have something to kind of really have a relief on the pandemic right now.
Shipments of Chinese vaccines arriving in Egypt. Manufacturers have struck deals to supply 400 million doses to countries around the world, despite having not yet released final stage test results. More than 1 million people in China have received doses under the government's emergency program. Beijing insists they're effective.
There have been some adverse reactions, but none are serious. More than 60,000 people have traveled to high-risk areas outside the country, and so far there's no serious infection. This proves our vaccines are protective.
In a race to secure COVID-19 jabs, nations like Indonesia, Turkey and Morocco have signed agreements with manufacturers Sinovac, Sinopharm and CanSino Biologics. But some have questioned the safety of Chinese vaccines, including Brazilian President Jair Bolsonaro, despite São Paulo State Governor João Doria already ordering millions of Sinovac doses. Cambodian leader Hun Sen says he won't allow vaccines not recognized by the World Health Organization to be tested there. Previous vaccine scandals in China have led to concerns that manufacturers may be cutting corners.
In the past, there were businesses that broke the rules. For example, vaccines weren't stored in fridges. Due to lack of transparency, their international reputation has been undermined.
Stricter regulations in the US, UK and Europe have required Western vaccine companies to release trial data in stages. Chinese companies have not been subject to the same standards.
China's leaders are depending on the success of its vaccines to improve its international image, which has suffered since the beginning of the outbreak. Beijing has dismissed concerns about quality, saying it's simply doing its part to ensure developing nations have access to a COVID-19 vaccine. But experts say it has other motives.
Whoever has the most successful vaccine, the most efficacious vaccine, will be able to use that partly as a springboard into other areas of medical diplomacy, but then beyond that, into perhaps trade or social cultural connections, and eventually from there into geopolitical concerns.
Beijing says it will be able to manufacture 2 billion vaccines by the end of next year.
Hospitals across the Southland are in crisis, pushed to their limits with COVID patients, and health leaders are out with new warnings.
Yeah, San Bernardino County reported more than 4,300 new cases and 12 more deaths today.
Orange County, more than 2,200 new cases and 2 more deaths. Riverside County, nearly 1,300 new cases and 1 additional death. We are still waiting for LA and Ventura counties to update their daily numbers. Today, doctors from across the state came together virtually to sound the alarm on COVID.
They are pleading with people to stay home and stay safe this holiday season. KCAL 9's Jasmine Veal is live with new video from inside a local hospital. Jasmine.
Well, Leslie, this new video was released by Kaiser Permanente to just let people see the reality of what these doctors are facing inside. Doctors from 3 different healthcare systems and California's Health and Human Services Secretary joined forces today, making yet another plea to the public right before the holidays. New video from inside Kaiser Permanente's Downey and Fontana medical centers shows the stark reality of the current COVID surge and the impact it's having on hospitals. You can see COVID patients lined up in beds and hallways, and even more patients waiting outside hooked up to oxygen tanks under tents.
I'm seeing people die alone. I'm seeing nurses exhausted, missing their families.
And this video released by doctors from across the state aims to encourage people to help stop the spread of COVID by staying home.
If people continue to gather for the upcoming holidays, we are going to cripple our hospital system.
It's the number of beds filling up very quickly.
The chairman and CEO of Kaiser Permanente spoke outside Downey Medical Center today, where he says of the 278 patients, 70% of them are diagnosed with COVID. And in the ICU, 95% of the patients there have the virus.
As the hospital bed count continues to dwindle, we simply will not be able to keep up if the COVID surge continues to increase.
We have a line of COVID hero patients.
We're now seeing today, through the videos and the testimonies, the real impact of what's happened post-Thanksgiving.
The biggest thing that I hear from patients all the time is, I didn't think it was going to get this bad.
The vice president of Dignity Health shared this message.
So we have a simple prescription that we'd like to prescribe to everybody. Do not share the air.
Next, we have Dr. Tony Fauci.
Hi. 12/24/40.
So many in our nation are saying, if Dr. Fauci gets the vaccine, I'm going to get the vaccine. So tell us a little bit of why it's important.
Well, for me, it's important for two reasons. One is that I'm an attending physician here on the staff at the National Institutes of Health Clinical Center, and so I do see patients. But as important or more important is as a symbol to the rest of the country that I feel extreme confidence in the safety and the efficacy of this vaccine, and I want to encourage everyone who has the opportunity to get vaccinated so that we could have a veil of protection over this country that would end this pandemic.
Thank you, Dr. Fauci, for coming today. Any last-minute questions, concerns?
No.
All right. I'm going to just scrunch up a little bit here. Try to get a good intramuscular injection here. Thanks for helping out. And pinch. And before you let go, let me put a Band-Aid on. There we go. Okay, super. Thank you so much.
Our President-elect Joe Biden is receiving his first dose of the coronavirus vaccine. Mr. Biden has promised 100 million people will be vaccinated in his first 100 days in office. Let's watch.
Yeah, right behind on that other side. Thank you.
Okay. You need to know after you get the vaccine.
All right.
Are you ready?
I'm ready.
Okay.
I'm ready.
Did you get to pick his Band-Aid? Oh, I've got a Band-Aid.
Oh, you've been awful busy, haven't you, Sam?
Oh, we have been. We have invested.
God love you. We owe you big.
I know.
Whole staff. It's been incredible.
Everybody stepped up and is doing what they need to do. So that's good.
All right.
She's from Cameroon.
Thank you.
You want me to doctor?
Guess you need everybody watching, huh?
I know. So that's okay. That's okay, here comes nothing. You ready?
I'm ready.
Okay.
Got it up higher? All right.
Would you like me to count to 3?
No, you just go ahead anytime you're ready.
Mr. Biden, do you expect that teachers will have early access to the vaccine? And if so, do you think that moves the timetable to get students back to class?
Would you like a Band-Aid?
If you, that doesn't matter. If you think I need one, I'll put it on. Okay. Well, look, what I want to say is we owe these folks an awful lot. The scientists and the people who put this together, the frontline workers, the people who were the ones who actually,
did the clinical work. It's just amazing. And I wish we had time to take you through the whole hospital to see how busy and incredible you all are. And we owe you big. We really do. And one of the things is that I think that the administration deserves some credit getting this off the ground with Operation Warp Speed. I also think that it's worth saying that there's great hope. I'm doing this to demonstrate that people should be prepared when it's available to take the vaccine. There's nothing to worry about. I'm looking forward to the second shot. So is Jill. She's had her shot earlier today. She loves shots, I know, but I've had so many. But at any rate, is that for me? My next visit. And but the important thing is that it's worth stating that this is just the beginning. It's one thing to get the vaccine out, and now Moderna is going to be on the road as well. But it's going to take time. It's going to take time. In the meantime, I know I don't want to sound like a sour note here, but I hope people listen to all the experts from the Dr. Fauci's on, talking about the need to wear masks during this Christmas and New Year's holidays, wear masks, socially distance, and if you don't have to travel, don't travel. Don't travel. It's really important because we're still in the thick of this. It's one thing to have the vaccine show up at a hospital. There's another thing to get the vaccine from that vial into a needle, into an arm. And there's millions of people out there that are going to need this, frontline workers first. But I just want to thank everyone for all that they've done. There's some real heroes, some real heroes.
Christmas in Rome during COVID, where goodwill to others means socially distanced events providing presents to the poor and homeless. As welcome as these gifts may seem, what many people want this winter is the COVID vaccine. And now the first consignments of it have arrived in Rome, ready for distribution on Sunday, to people who the Pope says should be first on the list.
I pray for all those in charge of nations, companies, international organizations to promote cooperation and not competition and look for a solution for everybody, vaccines for everybody, especially for the most vulnerable and needy ones in every region of the planet.
As in many other EU countries, the vaccine will also start being distributed in Germany on Sunday. It's a development many hope will transform the situation.
We see the
long-awaited light at the end of the tunnel become brighter. We will come closer to the exit from this crisis step by step. How long the road will be depends on us. If we remain reasonable and patient, then we will gradually be able to do many things again that we had to do without for a long time.
The strategy many European governments are adopting is twofold: a return to hard lockdowns and the start of mass vaccinations. Their hope is to reduce the numbers of new infections and eventually lower a mortality rate that has been claiming the lives of thousands of people every day for some time.
As people back in France counted down the hours to Christmas, French expats in New Zealand were already clinking their champagne glasses.
Ici, on peut vivre tout à fait normalement, on peut prévoir des vacances, des dîners entre amis sans restriction. Donc voilà, pour le moment, même si nos familles et nos amis nous manquent, on n'est pas vraiment pressé de rentrer en France.
Even in Auckland, on the other side of the world, French traditions are never far.
On avait vraiment envie de se retrouver entre nous et se faire un repas dans la tradition française. Et voilà le joli plateau de fromage.
There's neither a curfew nor a lockdown in Tokyo, where Baptiste is on the lookout for French food. Mission accomplished, but at a cost: €16 for a camembert.
C'est un Noël un peu spécial par rapport aux autres années, parce que de une, je n'ai pas pu rentrer en France pour le célébrer avec ma famille, et de deux, on évite les grands rassemblements avec des groupes d'amis.
In Australia, the Perrault family gather around their computer screen to say hello to their loved ones. In normal times, they'd all be down under to spend Christmas in the sunshine.
En raison de la crise sanitaire, l'Australie a fermé ses frontières.
Nous ne pouvons donc pas rentrer en France, voir notre famille, et ils ne peuvent pas non plus venir nous voir.
For Lucy in Shanghai, it would be unthinkable to skip Christmas Eve.
Alors, dans ma famille, on se fait toujours beau le soir du réveillon.
With her Malaysian husband, Lucy wants her 2-year-old to discover Christmas for the first time.
Au début, j'étais très triste. C'était un petit peu dur pour moi d'accepter cette situation. Et puis, comme on a un bébé, j'avais quand même envie de lui transmettre cette petite magie qui se passe à Noël.
So it'll be Christmas with a cultural twist until they can return to France.
The world is making adjustments following a new and even more infectious strain of the coronavirus spreading in the United Kingdom and beyond. It comes with nearly 80 million known infections around the world, resulting in at least 1.7 million deaths. Holly Williams has more on the global impact of the pandemic this morning.
There were no crowds in the Vatican's St. Peter's Square yesterday, where normally they gather in their tens of thousands to hear the Pope's Christmas blessing. No worshippers in Notre Dame Cathedral in Paris, though they did broadcast this concert recorded in the medieval structure damaged by a fire last year. And here in London, many people felt that Christmas had effectively been cancelled, as we saw earlier this week in the city's commercial heart. The government says the country has entered its worst recession in 300 years.
This is Oxford Street, normally the busiest shopping street in all of Europe. As you can see, it is eerily quiet after a new mutated version of the virus was discovered here in the UK and London went into strict lockdown.
The authorities here said the new strain was more infectious.
A heartbreaking Christmas for millions of people.
Mixing between households, including on Christmas Day, was banned.
For Christians,
Queen Elizabeth gave her traditional Christmas Day message from Windsor Castle, where she's social distancing in splendour.
In the United Kingdom and around the world, people have risen magnificently to the challenges of the year.
But for thousands of truck drivers left stranded on the roadside when France closed its border to the UK, there wasn't much to celebrate, just frustration and anger. For Christians, this festival is a time of hope, symbolised by the birth of the baby Jesus. And amongst the despair and the loneliness, there is hope this Christmas. For billions of people of all faiths, it comes in the form of a vaccine.
In the Pope's Christmas Day address yesterday to a small, socially distanced group, he called for international cooperation by governments and businesses to make sure that everyone gets access to vaccines for COVID-19, especially the most vulnerable and the needy.
Nel Natale celebriamo la luce del Cristo che viene al mondo, sia alle violenze e alle ingiustizie, cari fratelli e sorelle. Oggi, in questo tempo di oscurità e incertezze per la pandemia, appaiono diverse luci di speranza, come le scoperte dei vaccini. Ma perché queste luci possano illuminare e portare speranza al mondo intero, devono stare a disposizione di tutti. Non possiamo lasciare che i nazionalismi chiusi ci impediscano di vivere come la vera famiglia umana che siamo. Non possiamo neanche lasciare che il virus dell'individualismo radicale vinca noi e ci renda indifferenti alla sofferenza di altri fratelli e sorelle. Non posso mettermi me stesso prima che gli altri, mettendo alle leggi del mercato e dei brevetti di invenzione sopra le leggi dell'amore e della salute dell'umanità. Prego a tutti i responsabili degli Stati, imprese, organismi internazionali, di promuovere la cooperazione e non la concorrenza e di cercare una soluzione per tutti, vaccini per tutti, specialmente per i più vulnerabili e bisognosi di tutte le regioni del pianeta. Al primo posto, i più vulnerabili e bisognosi.